High bar squats, low bar squats, which squat variation is best for you? Hey everybody, Dr. Michael Mash here with Barbell Rehab. Welcome to episode 2 of Whiteboard Wednesday.
Before we get started, make sure you subscribe to this channel. And if you're on YouTube, hit the alert notification.
Today, we're going to talk about the differences between the high bar and the low bar squat and why you may choose one variation over the other one. But first, let's define these two terms. The first one, which you'll see, is a high bar squat over here. This is when the barbell is carried on a muscular shelf created by your upper traps. So think of the high bar squat as the basic variation of the back squat you would see in a commercial gym. By carrying the bar on your upper traps, when you go into the hole, this is going to cause a relatively more vertical-ish torso in order to keep that barbell centered directly over the middle of the foot. On the other hand, the low bar back squat is characterized by carrying the barbell a little, maybe an inch or two lower on your upper back by a muscular shelf created by the rear deltoids. By bringing the bar down lower on the upper back, that means that the torso is going to have to incline a little bit more forward in order to keep this barbell centered over the middle of the foot. So why does this matter? Well, let's first talk about performance. Historically, if you look at the sport of powerlifting, the majority of the lifters are going to use the low bar squat variation because anecdotally and theoretically, you may be able to squeak out a couple extra pounds on the platform because you're going to be able to load up that posterior chain a little bit more. So there is a slight mechanical advantage. But when it really comes down to it, if you're just training for general strength, your general pop, and you're just looking to stay strong and healthy, it's not that much different than the high bar squat. So if you're a healthy individual, you're not dealing with any pain, my recommendation would be whichever one of these feels better is the one you should stick with. You can play around and maybe dose in the other variation on a couple cycles here and there, programming cycles, but when it really boils down to, there's not that much difference between doing the high bar squat or the low bar squat for general strength or muscle hypertrophy. Now, if we're talking about mobility limitations and pain, that's where one might end up being a little bit better than the other. When we start talking about mobility limitations and pain, let's go into the joint demands on the two different squat variations. For the high bar squat, because we're squatting with a little bit more of an vertical torso, this is going to require the knee to go more forward in order to keep that barbell centered over the midfoot. There's more knee flexion demand, and because there's more of a moment arm from the kneecap to where the barbell is, or the vertical load is, this is going to be more knee stress. Now, when I say knee stress, that's not necessarily a bad thing. If you're trying to stress the knee more, then you would choose this. But for somebody that's dealing with current knee pain and doing high bar squats, if the high bar squats are aggravating it, it may be a good idea to try and run a cycle of low bar squats in order to get that knee to calm down. Because as you see, when we incline that torso forward on a low bar squat, that's going to shift the weight backwards, and that's going to require less knee flexion and thus be less demand on the knee joint. So, knee issues, obviously there's all kind of things that play into a knee issue, but in general, if you're having knee pain with high bar squats, you probably would feel a little bit better doing low bar squats. So that's if we're talking about the knee joint. Let's talk about the shoulder. Which one do you think is going to cause more issues, potential for issues on the shoulder joint? It's going to be the low bar squat because you're going to have to get that barbell a couple inches down further than the high bar squat. So for those people that have currently cranky shoulders or they have an external shoulder mobility restriction, external rotation mobility issue, they may have trouble getting into the low bar squat. Now, let me provide this caveat. If you're new to low bar squatting, it's uncomfortable to get into. So do not mistake discomfort for pain. So my recommendation would be this. If you're new to low bar squatting and it bothers your shoulders, give it a little bit of time first to see if it will adapt. Give it about a month. If after a month your shoulders are still screaming, maybe you have a mobility limitation, maybe that variation isn't for you. Especially if you're dealing with rehabbing a shoulder injury. One of the things we know most about training with pain is if the body is having trouble adapting, you may need to remove the aggravating factor. So if the low bar squat is flaring up your shoulders, run a cycle of high bar squats allow the shoulder to calm down, and then gradually creep that bar back down the back to the low bar squat, if that's your goal. Now, so we talked about the knee, we talked about the shoulder, what about the hip? So if we talk about hip pain with squats, what I actually covered in last week's Whiteboard Wednesday, it's kind of hit or miss. So if you look at it, technically in a low bar squat, because the torso is inclined more, that's going to be more hip flexion, right? Because hip flexion is either when you lift your hip up or you bend forward. Both are actually causing hip flexion. So if we keep depth consistent, so if we squat to the same depth on both a high bar and a low bar squat, the low bar squat is going to require more hip flexion. So if you're somebody that's dealing with cranky hips and you're low bar squatting, you might want to give the high bar squat a try to allow because there's a little bit less hip flexion demand, so the high bar squat might be a little bit more tolerable for you when it comes down to hip pain. Ankle. The ankle's huge. A high bar squat is actually going to require more ankle dorsiflexion than a low bar squat. As you can see here, because the knee has to come forward, that's going to cause the dorsiflexion to increase. So if you're basically rehabbing an ankle sprain, you may want to start with a low bar squat or a variation that doesn't require as much ankle dorsiflexion. Or if you have an ankle mobility limitation, you also might want to stick with the low bar squat until you can start to restore that ankle dorsiflexion with ankle mobility drills. Because if you try and do a high bar squat with significantly limited ankle dorsiflexion, you're not going to be able to get that knee forward, and the torso is going to pitch forward, and that's going to cause an increased moment arm on the low back, which if you're currently dealing with low back pain, that might not be the best thing for it. If we recap, we go head to toe. Shoulder issues might do better with high bar squats because you don't have to keep it that far down the back. Hip issues might do better with high bar squats. Knee issues, low bar squats are going to be better for that because there's a little bit less forward knee migration. And ankle issues, you're going to do better with a low bar squat because of the reduced ankle dorsiflexion demands. If your goal is strength or hypertrophy and you're not competing in powerlifting, do what feels best. If you're trying to get that extra couple pounds on the platform, anecdotally, I'd recommend playing around with the low bar squat. Thanks for participating and watching this second episode of Dr. Michael Masher's Whiteboard Wednesday. Thanks, guys.